It wasn't long ago when Chief Jim Blocker of the Battle Creek Police was here during one of his updates and said, we have an issue here in Battle Creek where if police happen upon someone who might benefit from the use of a treatment facility for an addiction, there really isn't an option. And then what seemed like a few minutes later, it was announced there will be. And so here, I don't choke to death first. We'll talk about that now with Jeannie Goodrich at Summit Pointe. Good morning.
Good morning, Richard.
So this is good news. We're going to have an option for folks, particularly if police happen upon them, to get them help they need.
That's correct. And let's talk a little bit about that option. So, in looking at the history of how this came about 4 years ago through a recovery-oriented system of care meeting that is chaired by Dawn Smith from Substance Abuse Council, we started talking about a recovery center model and how that could work in the community. And so the conversation started, when I was a director. And so, through the years, we've had conversations looking at models, what makes sense in Calhoun County. In January, I had the opportunity to attend a meeting with Chief Blocker, called by Jim Rutherford from the Health Department and Dawn from SAC. And we were talking about the uptick in heroin overdoses and deaths. And so, it was a really relevant conversation. And so I sat around the table, I listened to the concerns and the problems, and Chief Blocker and I spent a little bit of time after the meeting and connected and said, is there a possibility? And so we had some conversations with the folks at Bronson and, kind of looking at how do we help the folks that are going to the ER? How do we help the police? What are options that we can look at? So Chief Blocker and I went and visited an engagement center in Washtenaw County, looked at the model that's being used in Kalamazoo, and then he gave me some information about a model out on the East Coast. So, it's in this community, it takes a little bit of each model to make it work. Okay. It's not a one-size-fit-all. So we're driving back from the center in Washtenaw County, and we're saying, this would make sense, but to replicate that center in Calhoun County, because we don't have the residential facilities, we had to kind of look at, well, what would make sense then. So I took the opportunity, I traveled over to Kalamazoo to talk to Southwest Michigan Behavioral Health, who is the payer for substance abuse dollars in Calhoun County, and said, here's the chief of police asking for a resource. Here we are with some models that I can lay on the table. What can we do?
Right.
And that's how it started.
And when we come back in a minute, we'll talk about what comes next on WBCK. We're here with Jeannie Goodrich from Summit Pointe talking about, the need for a recovery center in our area, and the ball is already rolling. So you saw some examples, came up with a notion for how this might play out. So what are we looking at now? We're on a timeline to get there now, right?
We are on a timeline. It was a pretty aggressive timeline. We're talking about having the center. We find out, yes, with Southwest Michigan Behavioral Health, we can get staffing. And so now I need to find a building. And so luckily, through our work in the past with the Battle Creek Community Foundation, they were able to help us with a building. So through grants, we have purchased a building. And so that's amazing. Yeah. Let's talk a little bit about what will go in the building and what our timelines are. So the building is on territorial. And the timeline is sometime in the fall. If you look at planning for this type of service, usually there's some conversations, we have discussions about how this would work, and then we go out and find a building.
Go slower than this,
That's right. Well, that was our plan until a building fell it really into our lap. And so the beginning of July, I went to the Summit Pointe board and said, wow, we have this really great opportunity for this program and this building. And so it kind of all came together really quickly. So while we're working on the building, because it's not exactly ready for opening, so while we're working on the building, we'll take the opportunity to look at processes and protocols for the police, protocols from EMS, and protocols when to take to the hospital, how to receive patients from the hospital into the recovery center. And so we're going to learn a lot from our partner at Washtenaw County. They have done a lot of the work already, and so there are protocols that we can use.
All right, that's nice when someone's paved a way for you a little bit.
That's nice, yes.
So will this facility then be one exclusively that you respond to the needs of folks who have come through the legal system or in the hospital, or can you accept someone who walks in and says, I need help?
Yes.
Yes,
all of that. So let's talk a little bit about the recovery center itself. So it hasn't been officially named, so we're still working on that piece. But the recovery center itself is a physician's office building, so it has two entrances. And one entrance, we will be running what we call a social detox. So it is a place where people can go that's safe and detox. And so we can accept people who have been medically cleared from the ER and come in. We can look at people that don't have a seizure disorder that, with those protocols with EMS and the police department, and accept those consumers. And, if somebody just needs a safe place, that would be a good place to go. Let's talk a little bit about staffing. So the staffing for the center is actually being staffed by recovery coaches. So recovery coaches are consumers who are through their journey of recovery and are at a place where they have received about 40 hours of training and work with our practitioners, but offer services. So, we talk a lot about, or they talk a lot about, to me, the population and building trust. And, when they're sitting across the table or, sitting in a room with somebody who has an addiction and they say, hey, I've been there. This is the journey I went on. It's not going to be the same journey for you, but let's talk about what makes sense for you. And so it breaks down the barriers that you typically would have if a provider is talking to a patient.
And they have a fair amount of purview on this, maybe from their own personal experience.
That's what they bring to the table.
Yeah. I think of the show Intervention, if you can imagine. And a lot of us, that's our exposure to this issue is through a reality like that. But if you look at the counselors, the interventionists there, all of them have come from the same travels in some instances as some of the folks with whom they are dealing and trying to help. So I suppose that brings a level of credibility, doesn't it? This thing, though, boy, you wish you didn't need this thing, but boy, sure do we, don't we?
Right. So recent statistics from Chief Blocker tell us that since January 28th, we have 51 overdoses and 7 deaths. And so it's unfortunate because every one of those represents someone's family, right? Someone's mother, someone's dad, someone's brother, someone's sister. So, the numbers, you kind of get desensitized, right, to the numbers, right? It's just a number, but you really have to think about the people behind the numbers, and that's what we're trying to impact.
What was that time frame again? 51 overdoses?
51 overdoses, 7 deaths since January 28th, and he updated me as of yesterday.
So that's 7 months, roughly. Wow.
Yeah, it's a lot.
We're talking with Jeannie Goodrich from Summit Pointe, a new recovery center quickly coming together here, and we'll talk more about that and how things are going at Summit Pointe when we come back in just a moment. We're here with Jeannie Goodrich from Summit Pointe. So this new recovery center then would be open, next week or something?
Yeah.
It's really fast.
No, we're shooting for sometime this fall.
Okay, so that's still pretty fast.
It's still pretty fast. It's on the fast track.
All right.
But with those kind of statistics, it has to be on the fast track.
Yep, 51 and 7 overdoses.
Yeah.
This is a big deal. So how are you feeling about Summit Pointe these days? Things where you want them to be?
Well, I think it's a process. So, I thought this morning on the way in where we were when we were last here.
Yeah.
And so we have started our strategic planning process. We have almost an entirely new board. So we're spending a lot of time on education, sitting back. What are our services? What should they be? Where do we go? As part of our strategic planning process, we are talking to our staff. We're talking to our stakeholders. We're talking to external providers and getting feedback. What do we do well? What would people like to see us do? And, how do we get there? And then obviously with what's going on with the budget and up in Lansing and the threat of, not sure what our payer system may look like in the future,
right.
We got to have that on the table. So it's really a great opportunity for all of us to kind of sit around and really start to think about what we will look like in a couple years, 3 years, and what are our action steps to get there.
As those budget discussions have gone on, there was a published report that alluded to that, as well as the presumed payment you'd be expecting at some point from your predecessor. The notion there was that it's sort of a line item there in a maybe kind of column. I guess that's the way you have to look at it.
It is. And so I think accountants are conservative and they don't put something on the book unless they think that it's going to happen.
Yeah.
And because of the judgment and because of the concerns about the payment, we have not put it on our books as a receivable. If we get it, great. Yeah, but it's not sitting there inflating our financials currently.
What kind of challenge does it make for you if you don't get it?
Yeah, so we've had some conversations. As you know, I have a general counsel in-house, and so we've had some conversations about what happens if we don't get it and what are the strategies. And I think those are a few months off, and the board kind of has to give me direction as to how actively to pursue it, what exactly are the steps they desire to take, and, what will be the outcome.
Would you say then that as long as you don't have it, it creates a hardship?
No,
okay.
I don't think it creates a hardship. It doesn't show on our financials now.
Yeah.
So it would be more like if we get it, great.
Yeah, and I guess if there's a position to be in, that might be a better one than sitting there and saying, boy, if we had that money, we could move
do
forward
this,
on
right?
this or that.
That's right.
Yeah, right.
Mm-hmm.
But it's a sizable chunk of money, though.
It is a sizable chunk of money, and it's not one that we forget about.
That's right. So there it is. All right. And as far as the Recovery Center, we imagine you'll be offering updates and so on as time goes along here.
I'd love to come back and offer more updates with a name, with an official start date, and talking more about protocols about how to access our services.
Okay. And that name, you think of Comerica Park or something. Could you sell the name and get some income from that?
That's exactly right now.
Yeah. So it'll be interesting to see how that comes together. But boy, what a testimony to community response to something urgent.
Yeah, it's really been great. And, there's not been a door that I haven't knocked on when I start talking about this idea that hasn't been opened. And so what a great response to the community, to us.
Yeah.
It's a true testament to the community.
All right, Jeannie Goodrich, Summit Pointe. We'll stay in touch.
Thank you very much, Richard.
Thank you.